Okay, so in patient in mHSPC and on treatment, so we monitor the response and the progress of disease with usually with PSA, then maybe periodically with imaging, especially the PSMA PET-CT, especially when there's some fluctuation or rise in the PSA level. So sometimes a small rise on PSA, we just observe it. But then if there's a significant rise or there's definite rise, probably we'll have a PSMA PET-CT to compare with the baseline to make sure that this is a real progression. And then when we define that it's a progression to the mCRPC stage, of course, we'll plan for the next step of treatment. And for those patients who do not have NGS before, probably is the good time to check the HRR status at least, yeah. Yes, and now because the PARP inhibitor is recognized and significant role in the management of prostate cancer, especially in mCRPC, so I think at some stage we should check the patient's HRR status. For many patients at diagnosis, when they have the biopsy, some patients will already have the testing. That is good, then we can use it as a reference. But for the patient who do not have the testing before, probably when the patient develop the mCRPC status, we should test it to make sure that there's mutation or not. Because I think with mutation or with not mutation, it will affect a lot of our decision in the subsequent treatment. And my personal opinion that if a patient presented with metastatic disease at diagnosis, especially those with high volume disease, I would do the HRR test or the NGS at diagnosis to prepare for the next step. Yeah. It really depends on the timing of the development, because we know that there may be some changes in the mutation, especially we know that in HRR status they may change during the process of disease. So if the testing time, the duration between the first testing time and the development of mCRPC is long, probably we should repeat it. Or if the patient initially has a negative test, actually is by a liquid biopsy, I think we should also retest it, because sometimes there will be false negative. Because again, it is very important in our decision.